What is the difference between a person that suffers with mental disorder, such as bipolar, and a person that suffers with a medical health issue, such as hypertension? I am here to prove to you that there is no difference in these two. While one is a mental health problem and the other is a medical problem, they both have similarities, but they have different symptoms. We cannot visibly tell if a person around us is bipolar or they have hypertension. When I finish with this speech, I hope that you will be able to see the difference in the two. Today, I want to persuade you to stop and think about the discrimination that is against people with mental health problems. I have worked in the mental health field for almost 15 years, and this stigma of mental health is something I feel very strong about. According to the article Mental Health Stigma and Discrimination, they stated that mental health is attracting and increasing public attention. However, this impact is negative not only for the patient but also for their family members. Mental health disease is no different than a person that suffers with a medical disorder such as hypertension. Bipolar disorder affects over 5.7 million people alone in the United States and 60 million people worldwide, according to the article about bipolar depression. In the article Journal of Family Practice, treatment for this disease is medication along with therapy. This helps a patient that suffers with bipolar live a better life. The medication is to help the patient not to relapse or have another episode of their disease. These medications are to be taken on a schedule and daily. Some are taken in the morning, some are taken at night, but some can be taken both morning and night. After a patient has been diagnosed with bipolar, a patient may have to be hospitalized to get their medication started, and so they can be monitored by the medical health facilities. Lastly, doctor's visits will be set up after a patient has been diagnosed. They will start monitoring a patient's medication monthly. After they see that the medication is starting to work, the doctor's visit will taper off and eventually go to once a year. Hypertension is recognized worldwide as a leading risk factor for death and disability, according to the article in Texas Heart Institute Journal. The article also states that about 1 million adults in the United States suffer from high blood pressure. There was a study done, the effectiveness of blood pressure management application. It showed that with medication given on a daily basis and on a regular schedule, it helped patients with hypertension live a better life. They also recommended that the patient change their diets so it would improve their hypertension issues. On another similarity with the bipolar, the doctor's visit was a must. They say that you start out every month going to the doctor, managing your medications, and like with bipolar, they'll taper off and go once a year. Lastly, hospitalization may be required for people that have hypertension. If you cannot get your blood pressure under control, you will be hospitalized because this could lead to stroke, heart attack, or even death. We can see that there is no physical abnormalities with either of these diseases. So why is there such negative towards mental health and we are so lax with the medical issues? When most people think of mental health, they automatically think of people in straitjackets. But I can assure you that is not a practice that they use today. And they also may think of people that have physical appearances of mental health on their faces, like with mental retardation and things like that come along with their disease. Bipolar and hypertension are both treated with medication, doctor's visit, and sometimes hospitalization. As we come to an end of this speech, I hope that I have shown you both that these two diseases are treated the same way medically, and that there are no visible signs for either person who suffers with each disease. I leave you with a quote from Thomas Overby: "Beauty is only skin deep."